Welcome back. We have a visitor in the house today, Dr. Jack Ramage. He's a gastroenterologist with the New Hanover Regional Medical Center Physicians Group. So Dr. Ramage is here to talk a little bit about gluten intolerance. We were mentioning off air that you see it everywhere. This is gluten-free. You can get gluten-free pizza. You can get gluten-free this and that. What is it actually about the gluten that causes people so many problems?
So gluten is a protein that's in barley, wheat, and rye primarily. And some people are unable to tolerate this. And the classic form of intolerance is called celiac disease, where there's actually an immune reaction of the body causing inflammation in the small intestine. And it can cause symptoms in the GI tract, such as diarrhea, bloating, pain, anemia. And there's an entity that's become popular now known as non-celiac gluten intolerance. So they don't have the classic celiac disease, but patients have some of the similar symptoms. And so it's been popular, like you say, in the restaurants, the grocery stores, to see gluten-free foods. The most common foods we think about that you get gluten from are pastas, baked goods, breads, and processed foods, and even like supplements. You know, you think about a health food store, they'll have fillers that contain gluten. So when we diagnose a patient with celiac disease and say they need to change their diet, it's a dramatic change.
You mentioned the symptoms of the disease. What are the indicators that would lead a person to believe, well, I might not have this, this, or this, I may actually have a problem with gluten?
Well, like I say, in the GI tract, the most common would be the discomfort, abdominal discomfort, which is a pretty general symptom. Diarrhea, something their doctor might find as anemia or low iron. There can be celiac disease can affect any organ of the body. So thyroid disease, thinning of the bones, cause migraine headaches or neurologic symptoms, seizures. So the symptoms themselves are fairly general, so you have to have a suspicion for it. The classic form of the disease, celiac, is only about 1% of the population, but again, there's this other entity, gluten intolerance, that kind of broadens the population.
And quickly, a brief summary of the treatment that patients could expect?
So the treatment is simple, but hard. It's avoidance of gluten, so changing the diet. And again, luckily now there's, like you said, all the different food availabilities in restaurants and grocery stores. But it's a dramatic change. The other thing I didn't mention is beer and ales contain, but now there's gluten-free beer even. So.
Okay, Dr. Ramage, I appreciate the time, and obviously for more information we can come to you, come to any of the sites on the website to direct us for more information on that.
Thank you very much.
Thank you. And so now we'll take it over to Colin for more information.